Hello, my name is Stacy Sexton and I'm the stroke coordinator at Eastern New Mexico Medical Center. Let's talk about stroke. Did you know that every 40 seconds someone in the U.S. has a stroke, and it is the 5th leading cause of death in the U.S.? There are 2 types of stroke. Hemorrhagic stroke is when there is a rupture of an artery in the brain. Ischemic stroke is when there is a clot in an artery, causing decreased blood flow to the brain. There is another type of an event called a TIA, or transient ischemic attack. You may have also heard family or friends call them mini strokes. This is when blood flow is diminished or blocked for a short period of time and you return back to your baseline level of normal when the blood flow is restored. Do you know if you're at risk for stroke or TIA? Let's review. Do you have any of these risk factors? Are you greater than 55 years of age? Are you African American, Hispanic, Asian, or Pacific Islander? Are you a woman? Do you have a family history of stroke? These are considered uncontrolled risk factors. These risk factors are out of your control and increase your risk of stroke or TIA. The American Heart Association has identified some additional stroke risk factors you can control. Has anyone told you that you have high blood pressure? Have you been diagnosed with atrial fibrillation? Is your fasting blood sugar greater than 100? Or have you been diagnosed with diabetes? Is your body mass index greater than 25? Do you eat a diet high in saturated fat, trans fats, sweetened beverages, salt, or excess calories? Is your total blood cholesterol greater than 180? Do you participate in less than 150 minutes of physical activity a week? Do you smoke? If you answered yes to any of these questions, you're at an increased risk of stroke or TIA. But great news! These are risk factors you can change. You should have your blood pressure checked, and if it's elevated, discuss with your care provider how you can lower it. If you take medications to assist with lowering your blood pressure, be sure to take them as prescribed. If you've been diagnosed with atrial fibrillation, it's super important to have your regular checkups with your care provider to develop a treatment plan. Atrial fibrillation is an irregular heartbeat that can increase the risk of developing a clot that can cause a stroke. By eating a healthy diet, low in sweets, red meats, saturated fat and cholesterol, and high in fruits, vegetables, fish, whole grains, and low-fat foods, you can manage diabetes, high cholesterol, and obesity risks. 150 minutes of physical activity per week can reduce your risk of stroke. You can divide it up into 30 to 40-minute sessions 4 to 5 times a week. If you smoke or are exposed to secondhand smoke, discuss with your care provider nicotine replacement options and/or smoking cessation programs. If a stroke is identified early, there are treatment options available. An easy acronym to remember is B FAST. B, balance. Are you experiencing a lack of balance or dizziness or having trouble walking? E, eyes. Are you experiencing any vision loss or vision changes? F, face. Do you have an uneven smile or a facial droop, or you are experiencing a severe headache? A, arm. Is one or both of your arms weak or numb, or are you unable to lift one or both? S, speech. Do you have slurred speech, trouble finding your words, or difficulty understanding what you are being told? T, time. Timing is everything. If you are experiencing or witnessing someone else experience any of these findings, call 911 right away. Here at Eastern New Mexico Medical Center, we have worked with local EMS providers to develop protocols to get you the help you need fast. And if indicated, medications known as clot busters or Ultiplace may be given. Patients who present to the emergency department within 4.5 hours of stroke symptom onset may be eligible to receive this clot buster to dissolve the clot and restore blood flow to the brain to minimize neurological deficits caused by stroke. Patients may also require additional intervention called thrombectomy or surgical removal of the clot if there is a blockage in the large vessel of the brain, and will be transferred to a center capable of performing this procedure. We see a lot of patients in our community with stroke-like illness at Eastern New Mexico Medical Center Emergency Department. Unfortunately, many of these patients we see have waited several hours, if not days, before they come to our facility to receive care and are no longer eligible to receive the clotbuster medications available. Our goal is to get the word out to our community about the importance of getting help early, so we may be able to help treat and dissolve that clot, ultimately returning you to your home at discharge with little, if any, deficits. Thank you, and remember, be fast. The life you save just might be your own. I'm Stacy Sexton, stroke coordinator at Eastern New Mexico Medical Center.